that you need to know about starting at the beginning of this new year. So insurance changes. So with the beginning of the new year, you're probably going to see some insurance changes. So please make sure you bring your new insurance card to the pharmacy, because what may happen is the pharmacy is trying to process your refills and the old insurance is rejecting. And I have seen in several situations where sometimes patients will bring the insurance card, and let's say this is 2023 and you bring us the insurance card that says effective 2020. Please make sure you look at the insurance card and make sure you bring the right one with the right effective date. And a lot of pharmacies now have software where they can do a search to see if you have any active insurance. But just in case they don't have that software, just bring your insurance card, or call them and say, hey, can I just give you my information over the phone proactively.
And you don't necessarily even have to bring your insurance card. I know sometimes plans can be slow about providing you with your new card. So another way that you can be proactive and help the pharmacy is by actually calling your plan and getting the information from them. There's going to be 4 pieces of key information that you need to collect. That is going to be the BIN number, the BIN number. We're going to also need a PCN number, a group number, and then your member ID. So if you can just bring in those 4 pieces of information, even if you don't have the card, that will help us out a lot.
Okay, and then the PCN number, sometimes it can contain letters too, so don't let that confuse you.
Don't most insurances now have some online portal that you can go in and print your cards out?
Shockingly, a lot of people don't set up those portals and those accounts, so they don't have access to it, but that is available.
That's probably quicker than calling at this point, though, for sure.
Yes, and then also be aware that a lot of times, insurances have at least two different types of coverage. You have your medical coverage, and then you have your pharmacy coverage. So you may have 2 different cards, which means you might have 2 different ID numbers. So the same ID number and the same billing information for your medical insurance, it may be different from what the pharmacy needs. So just keep that in mind.
Since we're talking about insurance changes, a lot of patients who are on Medicare, if you're 65 years and up, your Medicare tends to renew at the start of the new year, which means your deductible renews as well. So that means that at the end of the year, when you were getting your meds fairly cheap because you passed that gap, and you probably more than likely paid your deductible, it starts back over. So don't be surprised. Some of your meds might be a little bit more expensive than what they were at the end of the year because your deductible has started. And depending on what type of plan you have, and that's something important that you might want to ask also while you're calling to ask about insurance, or you've gotten your new card, is to look to see what your deductible is. It's not the same for everyone. Just because your uncle got one that's $500 doesn't mean yours is $500. Yours could be lower, it could be higher. And once the deductible is met, generally your medication, it'll drop down in price. With that being said, and I kind of jumped ahead a little bit as far as tips with regards to Medicare, and I think I might have mentioned this previously. It's sometimes beneficial to get yourself a 90-day prescription versus getting yourself a 30 days. Sometimes the price is the same. So while you were thinking about having to pay this higher deductible, it may benefit you to get that 90-day supply that might cost the same as your 30-day supply ahead of time. And even with regular insurance, sometimes that is true. So that 90-day supply might be the same price, might be $5 for your 30 days, might also be $5 for your 90 days. We talk about saving money for 2023. You might want to go ahead and check that. And a pharmacist can actually run that for you. That might not even be something that you have to call up for. You can say, hey, how much is my 90-day prescription versus me getting 30 days? And how much will I save by doing that? Because I'm trying to save for 2023.
Prior authorizations.
Oh yes, we've actually had this discussion in a previous video, but for any of our new viewers, if you're unsure what a prior authorization is, it is actually a restriction that your prescription drug plan will put on a medication. It typically puts these restrictions on brand name drugs or high cost medications. And pretty much what will happen is your provider will need to reach out to your plan and provide them with various information. Typically, your plan is going to want to know, 1, if the medication is medically necessary, and 2, they want to know if you've tried and failed a cheaper alternative. Now, this process can take some time. I typically like to tell patients, give us at least a week to get it worked out, because many hands are going to have to touch or be involved in this process. So one, the pharmacy has to reach out to your doctor's office. The doctor's office then has to submit the information to the insurance plan, and then they have to actually read through all this information, and that can take time. Right now it's the beginning of the year, so a lot of people are dealing with these PAs, so everyone is stacked up. But we're trying our best to get it all done for you, but that will be an issue that you'll most likely run into, especially if you're on a brand name drug or a really expensive medication.
And I will say it does help to call your doctor's office. I used to process prior authorizations at a previous job on behalf of the healthcare providers. And sometimes when I get the stack of prior authorizations that the physicians or the nurse practitioners need to process, the stack, and I'm not even exaggerating, thick stack. And so if you're at somewhere in the middle or at the bottom, it may take some time for me to get to you. And if I'm only one person processing those prior authorizations, and sometimes there were other people, but let's say somebody is on vacation, if there's only one person, but when you call and say, hey, I need to speak to the doctor or whoever processes these from my doctor's office, sometimes that does help move your name up because you're actually calling, okay, this person needs it. And we know that this person needs it right now. Well, we know that everybody probably needs their medication right now, but when you call, it can help expedite things because we can sometimes move your name up to the front. Okay, this is a priority. We need to get this done. Contact your doctor's office. And unfortunately, I know a lot of times you have to leave voicemail messages, but it's your medication, it's your health, and no one is going to advocate for you like you can a lot of times. So keep calling until you get some results.
That's a good tip. So you can definitely reach out to your doctor's office and ask for them to kind of expedite the process. But I've worked on the other end. I've actually worked for a prescription drug plan. So at the beginning of the year, we get hit hard. So you have hundreds of PAs coming in. So even though you can expedite it on the provider's end, on the insurance end, that can still take some time. But any way to try to speed up the process, do it.
Thank you all for joining us again for that Pharmacist show. I am one of your hosts, Dr. Q. Joining me today was also
Dr. Mariko,
Dr. Shamita,
Dr. Tip.
We hope you will join us again for that next episode of That Pharmacist Show. Have a great 2023, the year of me.
And don't forget to like, comment, and subscribe. And leave a comment for us, please.
Bye for now.
Bye.